Microphones?
Boom, new microphone.
Neil, how do we sound? Check, check. Check, check. How do we sound?
I won't know till later.
We got new microphones, everybody. It's going to be a changing world. I see the blue lights blinking.
Is it blinking?
Tonight, welcome back, everybody.
is.
First and foremost, to the Off Blip Radio Show.
Show number 712.
712. We thought we'd actually last 5. So, we're doing
And I've
great.
been on 4.
Well, I didn't
Gail,
know. I
welcome
thought
back.
you'd been on
Here.
3, and I thought this is. By the way, introduce our guest. You know
Well-
I'll go with the name. Dr. Gail Newel
And
Dr. David Ghilarducci.
Ghilarducci. How's that? Is that good?
So impressive.
Is that good?
Yeah, it's fantastic.
Apparently, one's still working, one's retired,
But
but
they're
one
gonna
wants to
maybe switch?
But one wants to not work, and one wants to go back to work.
You don't know how to retire. We'll see what happens to Gail. Yeah.
First off, welcome back, both of you.
Thank
you.
For those of you who don't know, this is our county health
Officers.
officers. Is that the best way? You're an officer, correct?
Yep.
Okay.
Uh-huh.
Our county health officers, during one of the hardest times in county health history, you guys had to steer a ship. It's funny.
Well, you guys had to steer a ship without a map because you
Well,
had no idea. We had
We had
no
to
idea, right?
fly a plane while we were building it.
Yeah.
Makes sense.
Yeah.
But did you have somebody that was like, you had to coach yourself basically through this, right?
Yeah. Well, we had other counties that we talked amongst each other and trying to figure out kind of on the fly what to do. So, I can't say we were completely alone, but when it comes down to making decisions, and Gail, my God, my hat goes off to Gail because of the courage to make some hard decisions that we knew would be unpopular with some people, but we were doing the best we could on that based on the information we
A
had.
virus nobody knew about.
Exactly.
Brand new.
Yeah.
Looking back, I just one quick question. Looking back, I know that you had protesters at your house. People were threatening you, and all you're doing is trying to look out for the health of your community. Looking back, is there one thing that you wish you would have done differently?
Well, that's a good question. Boy, I might have been even a little tougher.
Yeah.
Yeah, I think so.
You know what? You're satisfied?
No, you would have been tougher, right?
Oh,
You're
tougher.
Yeah, a
You're
little
tougher?
tougher if anything. Yeah.
Tougher in the thick skin toughness of it, or tougher on how the community in our county, how you enforced what we need to do.
I think I might have done a little more masking for longer.
Mm-hmm.
Masking requirements.
Yeah.
But
But
when
there was
you're
a lot-
getting death threats and protesters are at your door,
Yeah.
it's hard to keep going
Yeah.
with that kind of stuff. But we did great. The community, we couldn't have done it without the whole community. But when you look at our numbers in terms of mortality rates, deaths per capita, they always say San Francisco did the best in the nation. We have better rates than San Francisco.
Yeah. That's amazing.
I feel that. My wife,
Yeah.
she had a hobby where every day in the paper she was reading the new infections, deaths, hospitalizations, and she was so proud. And I feel like a lot of what she was proud about is how you delegated and maybe enforced, regulated. But in hindsight, we did better. But
did
with you
better.
at the helm,
Yeah.
than like Florida or somebody else as an
Yeah.
example, And
Yeah.
so...
Well, the community gets a lot of credit for being willing to do what was best for not just themselves, but for the greater good.
Yeah.
Did you feel the community needed to be led by somebody, or was the community just kind of at sea doing their own thing? Was the community looking for a leader?
They were ready.
They were ready.
They were ready to
Right.
do the right thing.
Right.
But none of us knew what the right thing was.
Right.
We had to decide as we went.
Was
Right.
there a moment you're like, fuck it, I quit. I'm out of here.
Maybe right now.
Okay, we'll talk about that.
Not because
but
of
like,
this radio
but like,
show, but yeah.
I mean, there were people like shaking your fence in front of your house, but you're just like, is this
No,
worth it? Or
that made me more determined.
really,
Yeah.
you're a fighter. You said I'm gonna
Yeah.
keep in
Yeah.
this, and I'm in for the win.
Yeah.
Well,
Wow, congrats.
you got
on
on
that.
you in the New York Times,
Yeah.
right? There must have been something that. Why did they come seek you out for an article in the New York Times? You must have done something that was, at that time, different or unusual or unique.
Well, it wasn't just me. It was also Mimi Hall,
Okay.
our HSA director at the time. I think both of us had a lot of heart, and maybe that wasn't demonstrated a lot of other places, and compassion for our community. And we were willing to talk with the media, so the media gets credit, like you guys, for covering it in a humane, compassionate way. And Santa Cruz is a kind community for the most part, and really cares about their neighbors, and that shone through in the media. So LA Times picked it up, New York Times, and then NPR. We had a great little This American Life episode.
Did you save those? Did you cut them out?
Oh, sure.
Yeah?
Yeah.
Nice. Okay.
Yeah.
Well, it's also
Virtually.
Politics wasn't involved at all, was it? Was it?
well, absolutely.
What?
Well, because I'm just going to speak for myself. I felt like our leader at the time was like, it'll be a go away in 3 weeks type
Yes.
situation.
Well, you're talking about
National
national.
leader.
Yeah,
But I wasn't talking about national politics. I'm talking about local
no, but
politics.
I'm just talking about like national. I mean, I
But
felt
that
like
played a part, yeah.
you're trying to enforce something that somebody else is saying doesn't exist,
Yeah.
and that had to have been frustrating for you a little bit.
It was, but I don't think many people in our community were listening to the national voice. I think most folks were listening to state and local advice. And we had some really good state leadership. We still do. And really great Bay Area leadership. Our Bay Area colleagues really helped guide me through this whole thing.
Gail, did you concur? Did you get together with the people you work with, like David, before you made this decision, or was it something that you did on your own?
Yeah, no, I didn't do anything on my own, for
Right.
sure. We worked with county leadership, with our county council, our electeds, but most importantly were my health officer colleagues in the Bay Area. So we have a group called the BAHO, the Association of Bay Area Health Officers, and it's 12 counties and City of Berkeley, so 13 jurisdictions, and we tried to move together as much as possible through the pandemic. So Dave is interim health officer for San Benito.
Yes, that's right.
As well as being my deputy.
Interim means I want the job.
It means that we haven't found anybody else yet.
Which means that it's going to be your job. It's going to stay around.
It's a great place, but it's hard to recruit, especially health officers now.
Now, with San Benito County, just me from being the outside, it seemed like it started slower there, but then picked up later.
Yeah, in some respects, yeah. And I think the political dynamics, the local politics were different there in some respects than they were here in Santa Cruz. There was a little bit more of a kind of Trumpian style there, at least with some of the county leadership. That created some challenges. And if we have a time to talk about the national end of it, I think it is important. I know it's not local, but
No, it's good.
I'm reading a book right now. It's called The Divider. It's written by Susan Glasser, talking about the Trump administration, and what I realized in just the last couple of nights as I'm reading these chapters is we have to remember that first impeachment happened right at the time that this virus was emerging, and so the federal government in many ways took their eye off the ball, and those that did say things at the federal government level from the CDC were silenced because Trump was essentially distracted at that time. We were way behind on testing, way behind on PPE production and supply. If you remember those early days, really it was a pandemic of scarcities, one after another. And that did affect us locally. And so I can recall Gail and I having conversations about whether we should require masking. And now, of course, obviously, that is the thing to do. It's one of the most effective, cheapest prevention measures available. But we were really worried about everybody going out and hoarding masks, and then we would have not enough of them for our medical, our medical workforce.
It happened to me. I literally went to Bakersfield to get a vaccine.
I remember that.
Yes. I mean, I literally got in my car because I could get an appointment down there. But also, too, as a business owner, it was hard to get masks.
Yeah.
Because we required everybody to come in with one.
Yeah.
And it was also it was a gold rush of tourism to Santa Cruz then, like we were talking about earlier.
Yeah.
A lot of people decided that they couldn't fly, they felt safe in their car, and they came to Santa Cruz. And their counties didn't require masks maybe at that time, and we did. So we had to provide masks, and they were hard to get.
Yeah.
So you talked about before, there's an uptick right now, correct, in COVID cases in Santa Cruz County?
Just beginning.
Smaller, just beginning? But it's not a mortality, it's not people aren't dying for it.
We have had a couple deaths in
Have you really?
in the last 2 weeks, yes.
Almost always behind on their vaccinations. And if there's one message, and forgive me for interrupting, but There's a new booster out that is much more effective than the older boosters. That it's matched to today's virus rather than yesterday's virus. And I think a lot of people, we're seeing a kind of slow uptake of these boosters.
Yeah.
And a lot of people think, well, I've been boosted before, why do I need to get another one? Well, this is really a software update and super important. And those deaths that we've seen tended to be people that were, I'll say, under-vaccinated.
I've had 2 vaccinations. No, I've had 3. The original one and the 2 booster shots.
You
Do I need
probably
to-
had 2 and then, well, unless you
Yeah.
had the, did you have the 1 shot?
Yeah, I had the
series?
2 shot to start with. Then I
Yeah.
had my second booster shot. I had.
Did you get Johnson & Johnson? You got Moderna originally.
Yeah.
But you got to go get the bivalent.
That's the new one.
The new
The
one.
new one.
Yeah.
It's different. It's
Okay.
not.
It's-
That's
not
the
your
one that's-
grandma's booster.
It's in stores now.
Yes. That's the one that's going to protect you this winter.
Okay.
So people watching right now, they can go to the same place they got their first
Yes.
vaccine and get the updated booster.
What's it called?
It's called the bivalent
Yeah.
booster or updated booster. And they can go to My Turn online, myturn.ca.gov.
Right.
But if they just Google My Turn, it'll come up and they
Okay.
can find the next available appointments in the area that they select.
And you recommend that?
Absolutely.
Okay.
Yes.
All right.
And
Well-
they can get their flu shot at the same time.
You were
Yeah.
saying Thanksgiving is where we're going to see this upturn again, right? It's where people are going to be celebrating and cheering each
You've got
other.
different households mixing.
Right.
Yeah, that's where you're gonna see it.
Traveling. Yep. And then the weather gets cooler, and so we're all indoors a lot more,
Yeah.
closing our windows and doors, so ventilation isn't as good.
A lot of times grandma's there. Maybe,
Oh, yeah,
maybe, you know what I
that's
mean?
the
Like
danger.
maybe
Yeah.
her immune system's not as strong.
Yeah. My 89-year-old mom's going to be at our big gathering on Thursday, so
Is that
we're all going
nerve-wracking?
to test. We're all going to test
Mhm.
before we gather, make sure we're all okay.
Would you suggest that people who are having big family gatherings, who have 89-year-old moms coming, to share a test and make sure?
That's the recommendation is if you're going to gather and there's anyone there who's vulnerable, so whether they're elderly or chronic disease of some sort, that everyone tests to make sure they're negative that morning before you gather or that day.
What do we have in place now in case some other pandemic breaks out in the near future or the future? How are we prepared in any way, or you just have to see what shows up at the front door?
Well, unfortunately, our healthcare system is still experiencing a lot of shortages,
Okay.
especially around staff. So tremendous amount of burnout after the last 2.5 years. Lots of early retirements, lots of resignations, leaves of absence. People just are too burned out to work, healthcare providers. And so we have big staff shortages around the nation. And Santa Cruz, particularly bad because of our housing prices. It's really hard to recruit people here.
Yeah.
Even doctors and nurses.
And it's so funny because, like at Cabrillo, the nursing program is so impacted. I feel like that struggle is going to continue.
Yeah, and I don't understand that. I mean, there's such a demand for people wanting to go to nursing school. There's a demand for nurses, but we've got this choke point with the training, and it's been existing for a long time.
Long
And I
time.
don't understand
It's
why.
expensive to train nurses.
That must be it.
Yeah.
It's interesting, though, because I remember 30 years ago, my wife was thinking about going into nursing at Cabrillo, and it was like a 3 or 4 year waiting
Yes,
list. at
same
that
with my
time.
wife.
Yeah.
Right, that's right.
And I feel like we're still doing that same thing today.
Yeah.
Yeah.
So, would you suggest to somebody watching looking for a career, hey, get on that list because that's job security, good benefits, retirement.
Oh, yeah, absolutely.
know?
Sure. Yeah.
Yeah.
With all of us baby boomers getting to that
Yeah.
age where we're going to need a lot of medical care, it's job security for sure.
Earlier, Neil,
What?
Gail said she's in June. Is that the? Are we having the retirement party in June? Is that the
I think
plan?
we're going to have a retirement party here. Yeah.
At the
June.
boardroom.
At the boardroom.
I
Yeah.
like that idea.
Yeah.
So how long
Yeah.
have you been doing this? I'm not just as a health professional.
I've been a physician for 35 plus years now. Yeah.
Wow.
Delivered over 10,000 babies before I started in public health. Been a health officer now for 7 years. I thought Santa Cruz would ease me into a quiet little retirement. Little did I know what was on the horizon.
Wow.
So,
Okay, there's this guy here online. His name is Richard Leet. Now, Mr. Leet has a lot of complaints. So, Richard, what I want you to do is you can email me at otlradioshow@gmail.com gmail.com, and I will forward your email to Dr. Newel or to Dr. Ghilarducci. So I'm not going to take all your complaints here on just one show. So please email me, and I will forward your complaint to her, and I'm sure her office will get back to you as soon as they can. As she said just a second ago, they're short-staffed. They don't have a lack of people, so I know this lady very well, and I know she'll make do and get back to you as soon as she can. So again, Richard Lee, OTLradioshow@gmail.com.
Thanks, Richard, for that. Speaking of that, we posted you were coming on the show, and one of our favorite fans of the show said, "Can you please get the beaches closed again?"
That was awesome. I saw that comment.
Yeah. Well, in
Except the locals,
hindsight,
right? Yeah.
And I thought, oh man, he's being so snarky. So I ran it by my daughter and her boyfriend in their 20s, and they said, no, that was really awesome because we had the beaches and the waves to ourselves.
it felt like
Locals only.
It was a reward for the locals dealing with a pandemic. Because everybody was miserable, but we could still. We had a little slice of paradise.
I couldn't think of a better place to hunker down than Santa Cruz County, to be honest.
Oh, that's true.
No, we
You could have been stuck anywhere.
Well,
but-
we didn't. TC and I didn't hunker down. We put bands on the roof.
We did put bands on the roof.
We broke all rules.
Yeah. I heard you had a little law enforcement action there.
Well, actually, we did, but but TC took care of it. It was a pretty funny story.
Mr. Laird saved the day.
No, that was no.
It wasn't John Laird. It was
John Leopold.
John Leopold. John Leopold saved the day. Yes, and so the bands on the roof were great. Did we push the envelope?
Yep.
Maybe.
Yep.
But
and
we
the
think-
bands on the roof were safe. It was the dance crowd down below.
yeah, it was.
You know what's funny? You know what's funny, Gail, is that all those shows that TC and I did, or I did many of them, all those musical shows, not one person came to TC or myself and said, "You whatever,
Right.
we got COVID from your show." Not
Right.
one.
Well, because it was
You were
outside.
super-
It was outside.
Yeah, but we didn't get anybody. No one ever said they got COVID from our show.
We asked for forgiveness and we got it. It worked out fine.
Yeah, that's the way to go. Yeah.
The beach closure was awesome. If there's ever a spike, we might want to think about shutting down the beach. Check IDs. You got to be a 20-year local to surf. That'd be a great way.
Yeah,
to go.
you have to go. You have to have been to high school here to surf.
We could do it based on the tides. Would that work?
Yeah.
Sure. Low tide locals, high tide valley. Okay,
Yeah, there you go.
We'll talk about that later. As we get closer to June, and you look back on your career, is there a moment that you felt was like your highest point looking back? Is there something, a memory of something that really strikes as
Yeah, it has to be with her wife here on the show.
Kelly? Oh,
I like
jeez.
this, being here with Kelly
she
on the
watching?
show.
When Kelly was on the show,
I wish we could have
that
you here.
was that had to be a top 3 highlight
Well, we'll
moment.
bring Kelly back.
Thank
Yeah,
you.
yeah.
Yeah.
Yeah. I'm really proud that I was part of the Bay Area health officers with the earliest shelter in place in the nation. That really saved lives. And it pushed the state of California and then the nation into doing shelter in place as well. And I know no one's happy that they had to shelter in place, but it really, really did save lives.
Yeah.
And
If you remember,
Can I just
Yeah,
say,
please,
do you have numbers? Do the numbers show that?
yeah, so we've had, in Santa Cruz County, we're at, I think, 276 deaths right now for the whole 2.5 years of the pandemic. And if we were in Florida, we'd have an additional 600.
Wow.
So almost 1,000 deaths instead of the 276.
Yeah.
Wow.
If we were elsewhere in California, we'd have close to 600.
Right.
So
right.
yeah, really, really good.
You know, an interesting thing about that when you look back is when we first did shelter in place, and there was all these people saying it's the hoax, it's this and that. I had one particular friend on social media, and every day it was like the China, just on and on and on. And then here comes the post. I apologize to everybody because my mom died of COVID.
Oh,
And he was, I know, but he was the one that was like spreading the disinformation that it's all fake. And at that moment, it just changed my outlook on the whole thing.
Yeah.
Like, this is not a selfish thing. This is about everybody.
Yeah.
And
We heard
yeah.
so many stories of people in the ICU begging for the vaccine.
Mhm.
And at that point, it's too late, way
Right.
too late. But
So if you do have it, and really that's the case, it's too late.
Yeah.
too late. Once you have the disease,
It's only
the
helps
vaccine won't help.
for prevention, right?
Okay, wow.
Yeah.
Well, I had
Didn't know that.
my friend Mark. He didn't trust the vaccine.
Yeah.
Fit human being, one of the strongest people I know. He was back getting ready to row a boat to Hawaii, and he was waiting. He got COVID. He told me a story. He was at his house. He was so sick that he got up. He didn't want to die inside, and he got up to go die on the deck. He wanted to die outside. And that's how bad it was for him.
Yeah.
And then 3 months later, he's like, I can't even walk up a hill right now.
Mm-hmm.
One of the fittest people I know.
Yeah.
Because he just missed getting the vaccine.
Yeah.
Yeah, so I had COVID a few weeks ago. Got it on a cruise ship. And I was prepared. I had my home test with me, and I had my Paxlovid with me
On the boat?
on the boat.
Huh.
Very mild illness, no rebound. Really sick only one day. Negative test at 5 days, so I was able to resume activities with a mask on and hardly missed a beat on my vacation. So
And it's important to point out that you were fully vaccinated
and I was fully
boosted, yeah.
vaccinated and boosted.
Right.
Yep.
Is that common for fully vaccinated and boosted when you do catch it to have a more milder
Yes.
Yeah.
situation?
And not only that, but both the vaccinations, the boosters, and the Paxlovid help prevent long COVID. And that long COVID can be debilitating for the rest of your life if you get it.
Wow.
So the boosters, the Paxlovid, really important to prevent long COVID.
There's people who are avid don't want to take the vaccine. There's people I know. I have friends of mine, avid. No way are they going to get vaccinated.
Okay, I mean that's
It's
the beautiful
choice,
thing
right?
about America, right?
Right.
Is we
You
can
get to choose.
we get to choose.
Yeah.
Yeah, and if they get sick, when they get sick, they'll get treated.
Yeah.
So
Yeah.
And hopefully they'll survive.
yeah,
Is
hopefully.
the plan,
Yeah.
right? But the long lasting, I'm vaccinated, boosted. I got COVID about 2 months ago. It was about 4 or 5 days of being sick, but about 2 weeks of getting really tired at 3 o'clock. That's what affected me. Is like suddenly I'm taking naps. Like I don't take naps, but that was like my long COVID.
Yeah.
I couldn't imagine it being double or triple of what I had not being vaccinated.
Yeah.
So can we announce today? Is he going to be the new Santa Cruz County Health Officer?
Don't tell his wife.
Congratulations! Oh, she's watching.
She may be, yeah.
Can we have some break? We need a bump. Can we get? We need a spike.
Okay, well, I'm definitely retiring in this fiscal year, so by May or June.
Okay. And who would you choose
And
to be?
well, I would choose Dr. Ghilarducci for
Okay.
Thank you.
sure,
That's
for
very-
sure.
Very kind of you.
Yeah, he's most
And Doc, do you want the
most
gig?
qualified.
I would love to do it.
Yeah.
It would be. I would. My aspiration would be half as good as Gail, of course.
Oh,
But you retired from other gig. You retired from other.
Yeah, I was a firefighter. I was an ER doctor. I run the EMS system here in the county. I have a lot going on.
Yeah.
But and I enjoy having a lot going on. But this would be a really important job, I think, and really important for our community.
Okay.
So we'll see.
And it's how do you get the job? How does he get the job? It's some paperwork. He has some paperwork he got to fill out.
Grab a pen.
I think there'd be a lot of paperwork.
he'd have to slide. He could slide in as the interim for a long time. because
Yeah, I
he's
know how
been
that
interim
works.
in San Benito.
Well, you've got some vacation time. You got to catch up on.
I do.
So
yeah.
he
I've been
slide
working
him
on that.
in. While you were in, was it Venice? And I saw you in Venice and got
Greece.
Greece.
Yeah,
Yeah.
Well, I mean, that's a great question. Is this you're appointed to this? Is it
Yeah.
no,
It's an appointment by the
Yeah.
Board of Supervisors.
yeah. Currently, I'm an employee, but for Gail's position, it would be appointed. That's right.
And there'd have to be the full-on thing. There has to be a full recruitment.
Okay.
But I don't know how many people are beating down the door to be health officers these
That's
days.
No, it
It's
doesn't seem like
pretty-
it doesn't seem like it'd be.
tough
Yeah.
job.
Yeah, I get it.
The Watsonville Hospital, that get reopened? Is that?
Yes.
It never closed.
It never closed.
Never closed. It is in the community's hands again.
Okay.
Very good news. So
Jimmy Panetta involved in that? Was Panetta involved in that?
Laird
Locals-
was the big player.
Laird was, okay.
Panetta as well. Rivas.
Yeah.
Yep. And community heroes. Mimi
Yeah.
Hall was a big player in that as well. Monica Morales, our new HSA director. Carlos Palacios, our CAO. Big
What's a C-
influencer.
Okay. So it never closed, but is it under a different?
It is. It's now truly a community hospital.
Okay. It's
run
publicly
by-
owned.
It's publicly owned.
Mm-hmm.
Yeah.
Okay.
Wow.
Yeah, which is amazing. And I have to say, the people down there are fantastic.
Yeah.
They retain the best leadership that they've had for years there. There's one guy down there, his name is Matko, he's a saint. And so we're really lucky to have that
Well, you guys are all saints for crying out loud.
Yeah, well,
right?
This guy's like,
Because
Next
we didn't
level
have
above.
if we didn't have some kind of system like health system, it would be a shit show.
What you said earlier really still shocks me about the 600 more lives in our community would be lost. That's just like fact. I feel like everybody watching would know somebody extra who passed away from
Yeah.
COVID, and you know, in hindsight, the closure sucked, but the lives were saved, and that was your goal from the very beginning.
yeah.
You know, it
Not
was-
just lives saved, but also prevention of long COVID,
right.
of hospital impact, because if our hospitals are full of COVID patients, then when a heart attack comes in, they can't get treatment, or a stroke,
Right.
or emergency surgery. So it was also about providing care for people with other illnesses.
Are we stuck with COVID? Is this a new thing that we're just living with now?
Yeah.
So it's here for the long run.
Yeah, for our lifetimes at least, it'll be here.
And will there
Yeah.
be surges of new variances and?
It'll probably be like the flu, where we need to get an annual vaccine that's updated, and it's still killing more people than the flu, but the flu's a killer too.
Yeah.
And
Absolutely, yes.
Flu's definitely spiking right now. We need to talk about the triple-demic, is what we're calling
the
it.
triple-demic.
Yes.
The triple-demic.
That's not
That
something.
sounds like Shark Week, Neil.
It sounds like.
It's not unlike it, yeah.
It sounds like something you get at Betty's Burger for the triple shake. Or the
When I
triple-
talked to PK at the Sentinel yesterday, he called it the three-headed dragon.
Oh,
I
great.
hadn't heard that one yet. but
Okay, so
three-headed
the
dragon.
triple demic is
Let's see
COVID,
if you know what they are.
flu, and that
RSV.
RSV.
Yeah, good job.
That's it?
TC.
Then,
Yeah,
thank you.
Yeah,
Respiratory
yeah.
Okay,
syncytial
so that's a
virus.
triple
You're,
demic.
you're next in line for health officer.
Thank you. Yeah.
Yeah.
You're the deputy.
Yeah, just
I'll
smoke.
help you. I'll help you
TCB.
out.
Yeah.
TCB, just smoke that. You'll be fine.
Yeah, exactly. Just a little doobie, you'll be fine. But so it's a triple demic. Is that a
Triple-demic.
different vaccination for each of them?
Well,
There's no vaccine for RSV.
Can you explain RSV? It's so new.
You would go for it?
actually, it's been around for years, but we would see seasonal surges of RSV. They're mostly affects little kids. Those are the ones that end up having to be hospitalized, generally less than 5 years old. They get this inflammation in the airways. We call it bronchiolitis. Sometimes they'll form pneumonia. But for us, for adults, usually we experience it as kind of the common cold. And to be honest, we probably caught RSV every year of our lives, every time you had the sniffles or whatever. Now what's happening, in some ways this is kind of the aftershocks of the COVID pandemic, is that because of behavior change over the last couple of years, there are kids now that are 4 and 5 years old that have never been exposed to RSV. They're getting it for the first time. In addition, all the kids younger than them. And so now our hospitals are really straining with capacity, being able to house or hospitalize kids that need treatment for RSV. Unfortunately, there's no vaccine for it yet. There are some that are in the works. We're hoping that we'll see one for kids, but one of the key features in Santa Cruz County is particularly weak in this area, but it's not unique to Santa Cruz County, is just very little inpatient pediatric capacity here.
Really?
Oh.
And we have no pediatric ICUs, a PICU in Santa Cruz County. We rely
Stanford?
on Stanford and Good Sam and Valley
But they're
Medical
all
Center.
full.
But they're
And
all
they're all full?
Every bed in
Yeah.
California is full.
Wow. That's
Really?
scary.
Every children's hospital in California is full too.
Yeah.
Well, that was the challenge with COVID. It was always beds, right?
Right.
That was always the.
Staffed beds.
Staffed
Right,
beds.
yeah,
Yes,
yeah,
it's-
yeah,
I mean,
yeah.
we got lots of beds.
Yeah, yeah,
It's
but
the staff to
right.
take
But
care
that
of
was
them.
always the like. there's no ICU beds right now.
Right.
Was always a big problem
Right.
with it.
And the people that you need to run the ventilators and all the things that go with an ICU bed.
So now we have all these inpatients, people who've been admitted to the hospital, but there's no staff bed for them, so they're lined up in the emergency departments. And that's dangerous. You know, they don't have appropriate nursing staffing. They don't have the right equipment, the right oversight.
And, you know, that brings up a point. You know, we talk about COVID deaths and very important. But I think the true measure of the cost of this pandemic in terms of human lives is going to be excess deaths. Excess deaths. Are you familiar with that concept?
No.
So how many more people died during the pandemic than would otherwise be expected to have died during that period of time?
Oh, okay.
And that number actually is a lot greater than just the COVID deaths themselves. It's the people that didn't seek care during that period of time. It's the people that had heart attacks that couldn't be seen right away because the hospitals were impacted with COVID and so forth. So the excess death is going to really be the true number that we'll look at. And in those respects, California and especially Santa Cruz County has done so much better than the rest of the country. Part of that, unfortunately, like, you know, we talk about risk factors like diabetes and obesity. Another risk factor is your political affiliation. And it's very clear, the data is very clear. If you voted Republican, you're much more likely to have died during the pandemic than if you had voted Democratic.
Where'd that come from?
You know, I think it goes back to what I was saying earlier, this kind of eye off the ball in the early parts of the pandemic, this thought that this was just another way to attack the president, was to, you know, come up with this threat. There was motivation to delegitimize the scientists from the CDC and early on. And so you talked about vaccine misinformation, mask misinformation, this is just the flu misinformation. All of that was stewing around. Much of it really driven, unfortunately, by one person. And, you know, I can't be more frank than that, how completely devastating that was. We're always going to see some hesitancy. We're always going to see some people that are, you know, maybe want to take a more sort of natural, holistic look at things and not use Western medicine. That's fine, but the degree that we saw and the political division that led to this, that division, is remarkable. I don't think we've ever seen that in the United States.
The case rates and the death rates in the red states, much higher.
Much higher.
Just across the board.
Wow.
It's interesting what you said, because I had a friend who had he was scheduled to have pancreas cancer at Dominican, and because of the load on the hospital, they sent him home. And he had an accidental overdose of pain medicine because he was in so much pain.
So sorry.
Yeah, it was really a tragic event, but it's interesting what you say about that, or people that were scared to get preventative, you know, medicine done.
They were afraid to go into the
They were
hospital.
afraid to go in, and that number, that really strikes a nerve, because I don't know how much research has been done or where there's a number put on that, but that's almost like that long-term COVID aspect of what we're talking about is the people that were affected because they were either needing medical care or scared to get medical care and couldn't get it. You know, and that's an interesting fact.
Are nurses overpaid? Too much, overworked and underpaid? It seems like a couple of nurses I've talked to, they just seem to be spending hours there at work and overtime.
Our nurses are paid well here in Santa Cruz County, even considering cost of living, but that being said, they're working overtime too hard. Big burnout.
We have a shortage, correct?
We have a shortage. Of all healthcare providers, but especially primary care physicians and nurses and nursing aides. Hard to afford to house here.
And two, also, I felt so terrible for them because they literally had to dress like they were on the bomb squad going to work. You know, like literally like in this full-on, I couldn't have been comfortable.
Oh my God.
And how nervous are you in those early days of not really knowing how terrible things were? I mean, I feel like they were so on the front line. Were they rewarded financially at all for being frontline? Do we know? Was there anything? No?
No.
I don't think directly. No.
I just feel like they were front soldiers on the front row,
For
charging
sure.
in the combat, and
They were first
You gotta
responders.
remember,
Yeah,
right.
and their colleagues were dying from COVID.
Yeah.
yes,
You know, and so the fear that they had to kind of bury inside themselves to be able to go to work and take care of people, their courage was just amazing. And then when they're faced with patients that come to them who are in denial
Right.
and so forth, really frustrating. And that leads to burnout. It's
Yeah.
like, you know, toxic stress.
And the deaths. So
And the
hard
deaths.
as a healthcare provider to have your patient die.
I got a question for you. 2023, right? You're on a deck chair in Cabo, San Lucas.
oh, that sounds nice.
Sounds
Corona,
good.
you got a Corona right here. You're kicking back. I'm retired. Kicking it, right? And he's your Santa Cruz County health officer, and he calls you to come help him.
Will you pick the phone up?
Would you pick the phone up?
That's a great question, Neil. I want to know the answer to this.
Would you pick the phone up? A and B. If he said, "Would you come back and help me?" Would you go?
Well, yeah. And we've
good
got
to
to
know.
thank the hundreds of volunteer physicians and nurses that worked in our Medical Reserve Corps.
Give 'em a round of
They
applause.
went into people's homes
Yes.
to vaccinate, to give
Yeah.
care, to test,
Yeah.
and they're still doing it.
Unpaid.
Unpaid,
Right.
completely volunteer.
I'm gonna give a tip. I'm gonna give a tip for everybody. Get your vaccination in Salinas
Good
at the
tip.
CVS because right next door is In-N-Out Burger.
Oh,
Right? Which opens at 10:30.
that's why you're fully vaccinated, right? Okay, now I
It
get
opens at 10:30. So make your CVS appointment at 10. You're in and
In-N-Out
out, and
Burger.
you're in line.
That's why you were always like, it's vaccination day. Neil's got like 18 vaccinations.
Make sure you get your Lipitor while you're at CVS.
Doubles.
Double,
all day long.
you got a shake. Yeah.
Wow.
Well, now they have a triple, right?
Well,
So
I
they got
thought
a
it would.
triple
I thought
demo.
if it would. You know, if it would mix with the vaccine going down, I wouldn't be sick the next day. That didn't work.
Maybe you get the triple for the triple demic.
Yeah,
Yeah.
right.
Very
right.
symbolic,
Yeah.
right?
That's
So
right.
we should probably hit home again on vaccinations because what you said earlier is that there's a new vaccination that will protect you from the new variant, and that is
Correct.
called
The bivalent booster
Yeah,
or
bivalent.
the up-to-date booster, but it's the only booster being offered now.
So if
All
you
the
were-
other
you don't have to
boosters
ask
are
Oh, the other ones
okay.
are
That's
obsolete.
what you get now.
So you just get a COVID booster. It's going to be this booster. It's the only one.
I got my booster, and my first shot, I had Johnson & Johnson the first time.
Mm-hmm.
No problem, I was fine. My booster, I was down for a day or
Uh-huh.
so. Is there any from this one? Is it one and done, and you feel great?
It's kind of the same.
Yeah.
So if
Sore
you're a little
arm,
bit down
yeah.
for a day or so,
Yeah.
and then you're
No.
okay.
Yeah.
Yeah, because have you gotten the new one yet?
No,
I haven't either.
No.
I just had a sore arm. Nothing else.
That's
Should we
all.
hit In-N-Out Burger, Neil?
Okay, my daughter came home, low income, because she was working at Mount Rainier as a search and rescue ranger for the whole summer season. She came home, she goes, Mom, where do I get a booster? And I said, go on my turn. And she said, hey, there's an opening at Beach Flats at the county pop-up clinic. I'm
Yeah.
going to bicycle over there right now. She was home in half an hour. She'd gotten both her COVID and her flu vaccine, and she got a $50 Target card.
Oh,
Whoa, how old?
Yeah.
Did you hear that, folks? Wow.
You get
Can't buy
50 bucks
In and
from
Out
Ta-
at,
you get 50 bucks from Target.
Well, that's amazing.
Yeah, so the
Right.
county pop-up clinics, a
Awesome.
lot of them will, and anyone can go. You don't have to be low income or limited income.
Oh,
And
there we go.
just look on My Turn.
My
and,
Turn.
Yeah.
So,
MyTurnCA.gov.
how important is that? I mean, as our county health director, to tell the people watching, how important is this next vaccination to you? Is it
The
like-
booster right
the
now?
booster, yes.
Well, it's not as important as the primary series, the very, very first one. So folks who haven't been vaccinated at all, they're still the ones we want to get in there. It's like about 15% of our population in this county. We'd love to have them get vaccinated. But beyond that, the new booster and the flu shot.
Yeah.
Get them together. Same
It seems
time.
to me, originally it's like, oh, people get the booster, they fall over dead the next day. That never really panned out, huh? All that stuff
Well,
is,
some of them did.
but
But not because of that.
But
right?
they
No,
fall
no,
over.
no,
They
not
fall
'cause of
over
the
anyways.
booster.
Yeah,
Yeah,
but
not
right.
Because they
of that.
didn't get the booster.
No, but but as far as like people getting sick from boosters, I just don't feel like there's much legs to that personally.
Right. There is a website that people can go onto and list all of their concerns about their possible side effects. So there's many concerns listed in there by people who are concerned, but they haven't panned out to be anything significant.
Right.
So anyone watching, we've done this now for years. The vaccinations are okay.
Yep.
And-
Aged 5 and up are eligible for bivalent.
And the beaches will be closed on Saturday and Sunday this month, weekend.
No,
Time.
no.
Can you just close one beach for us? Yeah.
Well,
Folks,
Pleasure Points.
Pleasure Point's closed today,
Surfers.
except for Newel and TC.
Surfers only.
yeah, right. Locals. Yeah.
Well, I know a bunch of surfers who thank you for that.
Yeah.
I know a bunch of locals that thank both of you for just being in the trenches.
Right.
You know, it's a thankless job. We thank you, but at the time, I know people were shaking your fence and
Death
were
threats.
pissed.
Yeah, death threats.
But in hindsight, thank you
We
because
did the best we could. You know,
Hey,
not
but-
knowing what the virus was.
you didn't have a rule book.
Yeah.
You made up the rules as we went,
Yeah.
and so at the time, I hope everybody who looks back just knows that you guys tried your best. We had one of the best mortality rates in the country, which we should be proud of.
Yeah.
You should be proud of. I, as a business owner, it was confusing. As I look back, I'm proud of how we handled it here. You know, and so I just feel like we won in that aspect of it.
And of course, there was economic hardship for a lot of people. We need to acknowledge that. And we tried to walk that tightrope, you know, between the economics of our decisions and the health and safety of the community. In the end, you know, there were some really hard times for many people, but I think most folks have come out okay on the other side.
I agree with that. I have a friend whose wife's a hairdresser, and oh my gosh, she's still pissed off.
Yeah.
You know, and
there's
so
no way to recoup that money.
Yeah, it's
We're
really
sorry.
tough.
So sorry.
you know, I'm one of them. This business we're in right now was closed 3 months. I have a business up the street that was closed 5 months, and it was tough to get it going, but we did, and I feel like we live in beautiful Santa Cruz, and we'll survive. We will
We
survive.
brought music to a lot of people around the world. You
We
know?
did.
You know, we brought
Yeah.
music to a lot of people from all over the world.
We
They were
had over
locked down,
100 bands
shut
during
down,
COVID, right? Over 100 bands?
230. or something
Yeah,
like that.
yeah, that's a lot.
But yeah, music helped a lot of people out.
Yeah.
We're gonna have a party for your retirement.
Sounds
That-
fun.
Are we gonna do that?
Yeah, let's do
Can it
Boardroom
be a dance?
bash.
Can we do a dance party?
Can the Stone Foxes play?
Yeah.
Is that a dance party?
Yeah.
Okay, so
But
we're
I
gonna do a
think,
dance
but
party.
I think we're getting ahead of ourselves.
Are we?
Because I think we need to have a show with Kelly. Okay,
Yes.
we find out
Oh.
we need
yeah.
to find out what's going on, what happened. We need to find out the scoop, and have them both come back
Yeah.
when the time is right, right? And then we'll have we'll have the
Yeah.
party.
Kelly, I'm sure is she watching? Do you think so? Kelly, if you're watching.
She's grilling steaks right now.
Oh, she is?
Yeah,
Okay.
yeah.
Yeah.
We'll grill her later.
Yeah. David, Gail, thank you so much.
Yeah.
Yeah, thanks
We
you
love you guys.
Thanks
Thank you
for
so
having
much.
us on.
Thanks for having us.
Thanksgiving, can we give a few last tips?
Yes, please do.
Okay.
Yeah.
Yes.
So don't go to a Thanksgiving gathering if you're sick. Stay home, really. If you're sniffly, if your kids are sniffly, just
Yeah.
don't put anyone else at risk and stay home.
Good
Even
call.
if you test negative. Yeah, if you're sniffly, don't go. Lots of hand washing. Open the doors and windows if you can, if it's not too cold, or even eat outdoors.
Yep.
Wipe down surfaces. COVID doesn't spread too much through surfaces, but RSV and flu do.
Yep.
So that's always good practice.
And after Thanksgiving, if you're feeling the sniffles or anything, stay home from work, stay home from school.
And wear a mask.
Wear a mask
Right.
if you're out in public. Yeah.
Okay.
If you're sick, if you have symptoms and you have to go out, wear a mask.
Okay.
And if you're vulnerable, high risk, wear a mask.
Okay.
And I'm going to warn you right now, there's probably going to come a time in the near future we're going to ask everybody to wear masks again. Recommended. Recommended, not required. Yeah.
Is Cabrillo still open? The testing facility at Cabrillo? Do you know?
I don't know, but if you go to our website, santacruzhealth.org, you'll see the testing sites that are currently open.
Okay.
Awesome.
I want the one to get the $50 Target card.
That's a
Yeah.
great incentive to go
I know.
get tested.
I'm going down there right now.
If it was an In-N-Out burger, the show's over.
Yeah.
I bet you can trade it.
Yeah. Right.
In-N-Out,
Yeah. For In-N-Out burger.
Okay, so we got a dance party coming up.
Yeah. No,
Congratulations.
seriously. Can we have
Thank you.
can we have the retirement party here with a band?
Yeah.
That would be fun, huh?
Uh-huh.
We'll do it.
If
Yeah.
Kelly says okay.
On the
too.
roof, right?
Do you have a roof here for
We
us?
do have a
Oh,
roof.
yeah.
Yeah, that's the after hours roof. Okay. Well, thanks you guys. I just want to say, Neil, can I speak for both
Yeah,
of us?
for sure.
Thank you for leading the fight. And I go back to that mortality rate. You won because of the dedication to our community.
We all
Gail's
did.
leadership.
Yeah, but I mean, it takes it does. It takes cojones to make those calls, and I just want to congratulate that you did that, and because of that, like you said, 600 lives are still here, and so congrats to that. I really appreciate it. Neil, next week we have some.
Oh, Sean Robards next week.
Oh,
You
What?
didn't even show your face tonight.
I know.
I know.
Come on over here.
Hang on a
Okay.
minute.
Come on.
Hang on a minute. We're gonna show the album.
Oh, please, can
Let's
we just?
describe. Hang on. But the album of the. It's gonna win
The
an
Stone
Emmy.
Foxes,
The
uh-huh.
Stone Foxes. You okay? Go ahead. You.
Please tell us about this.
This is San Francisco's rock band, the Stone Foxes. They just did
Put
an
your hand out of
album
the way.
release
Yeah.
on Friday night at the Great American Music Hall. And I was featured there because I'm the album cover artist.
Wow.
And there's a whole story to that that's part of the album.
Yeah, the album with,
So-
with the stitches down the front of your.
The lead singer
Yeah.
had open heart surgery, and so I did this art and line drawing for him, and then they used it on the album cover.
Wonderful.
So-
And show the,
It
can you
is
pull the
awesome.
album out? The album itself is a
Oh
beautiful
yeah,
color.
the album goes along with the art.
And this is the story that
This is a
talks
story
about,
about my art and the open heart surgery and my own cancer journey. And then,
That's right. You kicked his ass, didn't you?
yeah,
Well done.
yeah, just got my 6-month clearance from my doctors.
Good job,
And
young
so
lady.
it's a yellow-orange swirl
That is so cool.
vinyl
Yeah.
too.
Wow.
Yeah.
Yeah.
And if we're lucky, maybe they'll play for the retirement
That would
party.
be
Love
great.
it.
Yeah.
Stay tuned for June, folks. That's going to be a rager.
I'll bring
Start
the
working on
turntable.
that guest list right now,
All right.
Gail.
We got a lot of shows coming all through the end of the year.
Yeah, we got big shows coming up.
Yeah.
Thank you, T-Fox, Santa Cruz Waves, for allowing us to be on your platform. You can look iTunes, TuneIn Radio, Series, any
Major
podcast.
podcast platform,
Yeah.
and then later on tonight on YouTube.
Go there. YouTube, you can see a lot of our shows. But thanks, everybody, for tuning in. We will see you next week.
And go England in the World Cup.
What? Is that football?
Oh, wait, football. yeah.
Okay, I just want to make sure.
Soccer.
Okay, yeah.
I was up at 3 o'clock this morning. Right now, I'm like, I'm watching football.
All right, folks. Good night, everybody. We'll see you
Good
next
night.
time.
Stay safe.